watching News 8.
Dr. Matthew Devine, the medical director for Highland Family Medicine, is back with us. Good morning, doctor.
Good morning, Mark. How are you?
I'm great. Important topic for folks, illness in children and the school process when symptoms are concerning for COVID. There's been a lot of talk about this. Let's dive right in. But first, let's just talk about the health status of our children, our students, if you will, now 1 month into the new school year.
Yeah, this is a great topic, obviously pertinent right now, being a month in. You know, since the kids have returned to school, you know, we've been really following all of the cases for the county very closely. And I think essentially what's been going on is, to date, you know, there have been a pretty, you know, steady low amount of cases. And, you know, last week there was a little bump in that. And so we're obviously watching very closely and continuing to do those tracers to make sure that we continue to keep all of our children safe.
Tell us, Doctor, how school district officials are working with county health officials to keep students safe.
Great question. So the Finger Lakes created a task force where they're working with school nurses and healthcare providers and school leadership to make sure that everybody is on the same page. If there is a kid that comes in with a illness or concern, then it has to be addressed. And as you know, there are so many different options for school. You know, there's remote, there's hybrid, there's everyday in person. So those kind of vary based on the school district.
What are some of the challenges we're facing as it relates to students in COVID-19?
So I think the biggest challenge is that the trend continues that children are, if become infected, have mild cases, are asymptomatic, but it continues to be a concern about others that they can be exposed to. And so I think obviously that's a big thing of not spreading the illness, as well as this is a time of year where kids naturally get other bacterial and viral infections that most of the time are still other infections that are mild, that we have to kind of differentiate between the two, and that's what's making it so challenged.
Right, and so that becomes sort of the $64,000 question here. If you're a parent or a guardian, what do you do if your youngster develops an illness?
So I think each and every day that the kids go to school, they do these kind of daily health screenings that have to be asked, that have an algorithm that walk you through. And obviously, if you get a hard stop to call your healthcare professional, then you pick up the phone and do that, and they will kind of walk you through the next steps. And then depending on the results and the testing and all of that, they'll be able to provide communication back to the school, to the county, as to how to proceed next. It is quite complicated, Mark, but I think together, you know, we're trying to make it as easy as possible and efficient so that the kids can get back to school safely and continue safely.
For sure, safely, the key word there. Doctor, thank you for the time as always.